Mpox is a contagious disease caused by a virus from the poxvirus family. There are two known forms or clades of the Mpox virus, clade 1 and clade 2. Clade 1 typically lead to more severe illness and has a higher mortality rate compared to clade 2. The first documented case of Mpox in humans occurred in 1970 in the Democratic Republic of Congo. In May 2022, a case of Mpox was identified in the UK, followed by several others across Europe and the US, seemingly unrelated to each other. This outbreak was linked to the clade 2 strain of the virus. What made this outbreak unusual was how rapidly the virus spread in countries where Mpox is not typically found. Scientists were initially puzzled over how a virus that was previously thought to be less transmissible was spreading so widely. Most people infected with Mpox experience flu-like symptoms, such as fever, headache, muscle aches, fatigue, and swollen lymph nodes, along with a skin rash that includes pus-filled lesions or blisters. In severe cases, the infection can be life-threatening. Although there is no cure for Mpox at present, scientists and global health organizations are actively working on treatments and diagnostic methods. Vaccines are the primary tool for preventing Mpox, but many individuals remain uncertain about trusting this method of protection. This skepticism is often linked to a broader distrust of governments, pharmaceutical companies, and health authorities, especially after events like the COVID-19 pandemic. In this video, we'll be discussing the Mpox vaccines, how they work in the body, their side effects, and who should and shouldn't consider getting it. Watch till end to fully understand if you should take the Mpox vaccine for preventing its spread. Question number 1. What are the Mpox vaccines? The Mpox vaccine is designed to prevent infection from the Mpox virus, which belongs to the orthopoxvirus family and is closely related to the smallpox virus. During recent outbreaks, smallpox vaccines, which are about 85% effective in preventing Mpox, have been used to help control the spread of the virus. Currently, 2 Mpox vaccines are licensed for emergency use in the Democratic Republic of Congo. Jynneos, developed by Denmark's Bavarian Nordic, and LC16M8, produced by Japan's KM Biologics. Both vaccines reduce the risk of infection. In the US, 2 vaccines have been authorized for Mpox: Jynneos, which is also approved in Canada and Europe, and ACAM 2000 by Emergent Biosolutions. LC16M8, an attenuated smallpox vaccine, is licensed in Japan for use in both children and adults. However, the duration of immunity from these vaccines is still uncertain. The World Health Organization currently recommends the use of MVABN, also known as Jynneos or LC16 vaccines, and advises using ACAM 2000 only if the others are unavailable. Jynneos, also known as Imvamune or Imvanex, is a non-replicating live virus vaccine. On August 9, 2022, the FDA issued an Emergency Use Authorization, or EUA, for Jynneos, allowing healthcare providers to administer the vaccine intradermally or between the layers of the skin for individuals aged 18 and older who are considered at high risk for Mpox infection. The EUA also permits its use in those younger than 18 who are at high risk, but for them, it is administered via subcutaneous injection. Jynneos is a 2-dose vaccine developed to protect against both Mpox and smallpox. For optimal protection, both doses are required, with the second dose given 4 weeks after the first. If more than 4 weeks have passed since the first dose, the second should be taken as soon as possible. ACAM 2000, on the other hand, is a live, replicating virus vaccine originally developed for smallpox. It is administered as a single dose and has been approved for pediatric use as well. Because the live virus can be shed from the vaccination site and potentially spread to other parts of the body or other people, careful management of the vaccination site is essential until it heals, which can take up to 6 weeks. Additionally, BioNTech, in collaboration with the Coalition for Epidemic Preparedness Innovations, has begun a Phase 1, Phase 2 clinical trial for an mRNA-based Mpox vaccine candidate called BNT166, with the trial expected to be completed by May 2025. Question number 2. How each vaccine works in the body. The Jynneos vaccine contains a live, modified form of the vaccinia virus, which is a virus related to Mpox and smallpox. Although it is related, it is much less harmful than the smallpox and monkeypox viruses. When the Jynneos vaccine is injected, it introduces the modified vaccinia ankara or MVA virus into the body. This virus is weakened and non-replicating, meaning it can't multiply inside human cells or cause disease, but it is still recognizable by our immune system. The immune system recognizes the MVA virus as a foreign invader and mounts a response. This involves the production of antibodies and the activation of T cells, which are the immune cells that attack infected cells and coordinate the immune response. As the immune system fights off the harmless MVA virus, it learns to recognize features of the virus that are similar to smallpox and Mpox. This training process helps the immune system develop a memory of these viruses. If the person is later exposed to the actual smallpox or Mpox virus, the immune system will remember the invader and rapidly produce antibodies and T cells to neutralize it before it can cause illness. The other popular vaccine, ACAM 2000, contains a live, weakened, and replicating version of the vaccinia virus. It is injected into the skin using a special needle called bifurcated needle that pricks the skin multiple times, causing a small lesion. This lesion is a sign the vaccine is working. Once introduced, the vaccinia virus replicates at the site of the injection, creating a small, localized infection that triggers the immune system. Similarly to Jynneos and other vaccines, our immune system creates a strong immune response against the virus. The lesion eventually scabs over and heals. As the lesion contains live virus, which means the area can be contagious until it is fully healed. Special care is needed to avoid spreading the virus from the vaccine site to other parts of the body or to other people. Because the virus can replicate, ACAM 2000 carries more risk for people with weakened immune systems or certain skin conditions like eczema or those who are pregnant. So it is recommended to use ACAM 2000 vaccine only if the other vaccines are unavailable. The vaccine provides long-term protection by priming the body to respond quickly to real infections. Although the exact duration of protection is still being studied, vaccines like Jynneos and ACAM 2000 can offer immunity for years or even decades. Question number 3. What are the side effects of the vaccines? Like all vaccines, Mpox vaccines can cause some side effects, although not everyone experiences them. Most side effects are mild to moderate and resolve on their own within a few days. Redness, soreness, swelling, and itching where the shot is given are the most common things that happen after vaccination with Mpox vaccines. Tiredness, headache, fever, and muscle pain can also sometimes happen after vaccination. In rare cases, the ACAM 2000 vaccine may cause myocarditis and pericarditis, which are inflammation of the heart and the surrounding tissues. These conditions can be serious, but they occur very rarely. Based on clinical studies, myocarditis or pericarditis happens in about 1 in 175 adults receiving the vaccine for the first time. Like all vaccines, autoimmune reactions have also been reported as side effects of Mpox vaccine, but it is extremely rare. Fainting can occur after medical procedures, including vaccinations. If you feel dizzy, have vision changes, or hear ringing in your ears, let your healthcare provider know. While it's very rare, vaccines can sometimes cause severe allergic reactions. If you notice any unusual symptoms or side effects that concern you, contact your healthcare provider immediately. Question number 4. Who should not be immunized with vaccines? Because the virus can replicate, ACAM 2000 carries more risk for people with weakened immune systems. A healthcare provider may decide not to give ACAM 2000 if a person has a weakened immune system like leukemia, HIV, AIDS, transplant recipients, people with cancer that has spread, and those undergoing treatment with medicines that suppress the immune system such as steroids, prednisone, and cancer drugs. In addition, healthcare providers may decide not to vaccinate individuals with skin conditions such as eczema, dermatitis, or psoriasis who are at increased risk of complications, or those who are pregnant. People who are currently experiencing moderate or severe acute illnesses should generally wait until they recover before receiving the Mpox vaccine. If receiving other vaccines simultaneously, healthcare providers should ensure there are no contraindications or increased risks of adverse reactions. It's crucial for individuals to consult with a healthcare professional before receiving the Mpox vaccine, especially if they have underlying health conditions, are taking immunosuppressive medications, or have concerns about potential allergies. A healthcare provider can assess individual risk factors and determine the appropriateness of vaccination based on the latest medical guidelines and the individual's health status. Question number 5. Who should consider taking the vaccine? The European Centre for Disease Prevention and Control, or ECDC, has updated its recommendations in response to outbreaks of a new strain of the Mpox virus. ECDC says the risk of it spreading everywhere is low, despite the World Health Organization recently declaring the Mpox situation a global emergency. Deciding who should consider taking the Mpox vaccine and determining which vaccine to receive depends on several factors, including personal risk levels, pre-existing health conditions, and vaccine availability. Groups at higher risk, such as men who have sex with men, and individuals engaged in behaviors that increase skin-to-skin contact or involve multiple sexual partners, are advised to consider vaccination. Those who have had direct contact with someone infected with Mpox may benefit from post-exposure vaccination. Professionals like healthcare and laboratory workers, or who are likely to come into contact with the Mpox virus during their work, especially those handling specimens or caring for infected patients without adequate protective measures, should consider taking Mpox vaccine. Veterinarians and animal handlers should also consider, as the animals could potentially carry the Mpox virus. ECDC also recommends Mpox vaccines to individuals residing in or planning to visit regions experiencing outbreaks or high transmission rates. In settings like prisons, shelters, or other communal living environments where outbreaks can occur, vaccination may be recommended to control spread. In cases where exposure to Mpox is high, the benefits of vaccination may outweigh the potential risks for certain individuals who might otherwise fall into a cautious category. Healthcare providers can make informed decisions based on exposure risk, health status, and available vaccine data. So consult with your doctor to determine if getting the Mpox vaccine is right for you. The Jynneos vaccine is generally preferred due to its safety profile, especially for those with health conditions that contraindicate live replicating vaccines. The ACAM 2000 vaccine is an alternative when Jynneos is unavailable and for individuals who do not have contraindications with live vaccines. To conclude, we can say Mpox remains a global health concern, particularly with its recent spread outside traditionally affected regions. While there is no cure for the disease, vaccination is an essential tool in controlling its transmission. Although reinfection with Mpox is possible, it is extremely rare. According to unpublished CDC data, fewer than 0.1% of people in the United States who previously had Mpox have been reinfected. In these rare cases, the second infection was typically milder than the first. Due to this low risk of reinfection and the generally milder symptoms, people who have already recovered from Mpox are not currently recommended to receive Jynneos vaccine doses. Consulting with a healthcare provider is crucial in determining the best vaccine based on personal health conditions and risk factors. By taking preventive measures, including vaccination, we can significantly reduce the spread of Mpox and protect vulnerable populations. So, will you be taking the Mpox vaccine? Subscribe and stay with us for a continuous stream of expert advice to elevate your daily living and embark on a path to a healthier you.